So I went to undergrad in Boston College, followed by, I didn't take any years off. I went straight into dental school at BU. And then after my 4 years at BU, I ended up doing a 1-year residency at Harvard that was connected to the VA hospital. And that's called the general practice residency. It was mostly a focus on just being kind of like a super general dentist, where in dental school, they teach you the very basics of like restorative and, just kind of simple extraction, simple filling, stuff like that. And then you go to the hospital and you get kind of like a crash course on dealing with emergencies, a lot of hospital dentistry, which essentially makes you really good at treating like anything that walks in the door. You're kind of like a triage dentist. Like if anything comes in, you're able to treat it and get that patient in a way stable enough to go see the specialist if they need to see one. And that was most of my schooling. And then for continuing ed, I've done continuing education on implant placement. I don't place implants anymore, but it was great to just get a background on how to place them, because it helps you in guiding patients on, essentially getting the right referral basis out. I've also done continuing education on biomimetic dentistry, which is probably the largest passion of mine with dentistry, is restoring teeth in ways that mimic nature. So biomimetics it's kind of a new step away from traditional dentistry, where traditional dentistry is a lot of metal crowns and silver fillings, which are they're becoming outdated in a way. And then biomimetics is like a transition to composite resins for fillings, ceramics, like glass ceramics for crowns and onlays and partial crowns. And it's essentially, you're trying to put teeth together in a predictable way without removing unnecessary tooth structure. So you could dive into it. I think I could talk about biomimetic dentistry for hours, but the concept is like trying to treat teeth conservatively while also doing it in a way that you're enhancing the tooth rather than taking away from it to try to protect it. And that's kind of where dentistry is headed. And to put it into simple terms for a patient, you're getting better outcomes, you're getting less sensitivity after treatment, and you're getting more treatment for crowns and fillings that don't end up needing root canals after, which is what people care about. And that's why biomimetics is taking like a big step forward. I think more younger dentists are going to be trained in how to do it, because it's better for patients, and it's relying more on science than it is on like mechanical retention to hold things together.